Hello, thank you for joining me. My name is Ben Schuff. I'm a naturopathic doctor and dietitian nutritionist. I'm the clinic director of Whole Systems Healthcare Chicago. And today we're going to be talking about the terrain and the healthcare continuum in developing resiliency and acting proactively for our health. So in this discussion, we're going to go over the role of naturopathic medicine in addressing the terrain. What is the healthcare continuum? The consideration of the germ and the host, the likelihood of future pandemics, and shifting our uncertainty towards an opportunity. So we're living in an unprecedented time. And often when we encounter crises, it's either on a personal level or outside ourselves. And we deal with those in the ways that we do. But what's interesting about the COVID-19 crisis is that we are truly in the midst of a collective experience, one where we're holding a common challenge in our mind and facing it together in our own way, but collectively. And what this presents us with is a lot of uncertainty. And the most common response, understandably so, from this uncertainty is anxiety and fear, and not knowing what to do and what to do next and what the future will hold. And as a species, we don't do well with uncertainty. We like to know what will happen next, what we can do for our loved ones and for ourselves to keep us safe and protected. But for millions of years, we've been faced with uncertainty and novelty in our environments. And we always find brilliant ways to adapt and learn as a community. So today I want to express to you that we're not powerless now or ever. And we adapt moment to moment, and we'll adapt through this crisis. And we can develop foundations and practices which makes those adaptations even more efficient and flexible over time. Because viruses and other germs are not going to leave or be eradicated from our environments. So the emphasis should be on what we can do to improve our adaptability and reduce our susceptibility to these stresses. Currently, our healthcare system is acting in a heroic way. And what they're doing is remarkable. And our public health measures that we're hopefully all implementing on a grand scale are remarkable as well. And the role of integrative medicine or naturopathic medicine in our healthcare field is based on being able to differentiate how different practitioners operate based on the lens of training and the philosophy that they have received. And this also pertains to how your situation plays out when you interact with any level of the healthcare system. And recognizing where we are is guided by what we call the healthcare continuum developed by Craig Merman. It allows us to have a systemized way of knowing where different approaches to healthcare exist and how they all contribute to a more whole system and whole person approach. So when we look at the healthcare continuum below, we see that there's two different directions of how we can conceptualize health and healthcare. To the left, we have the reactive umbrella, or the pathogenesis red arrow, which is how disease develops. And to the right, we have salutogenesis, which is the factors that create health, and the proactive umbrella with restorative, preventative, and wellness. So with the reactive umbrella, it includes all the essential functions that are playing out in hospitals and clinics across the world as we speak in response to this COVID-19 crisis. This mode of medicine is focused on saving lives, managing symptoms to help people safe and out of danger to the best of the ability. But the point is, once the serious situation is already happening. So as the name states, it's reactionary in nature. It waits for people to get sick, whether it's the virus or any illness, and then reacts in a standardized disease-centered fashion to save a life or manage symptoms in a less life-threatening situation. And the important point is that there's nothing inherently wrong with this approach. It's absolutely essential and central to our society to have this type of safety net. But the limitations of this model and this approach are that it lacks a consideration in general of the why and the who of illness, focused more on the what and the how. So what I mean by that is that instead of seeing the person seeking help as a whole, asking, who is this person and why are they developing this problem now in the context of their whole story? The usual inquiry is, what is this illness called? What is the mechanism that allowed it to develop? And how can I use some sort of drug or surgery or procedure to reverse it, slow it, change it, inhibit it in some way? And sadly, sometimes it's to distill someone's vivid experience to an insurance code. But what I want to express to you today is that we don't have to wait to react to everything that happens to us. It's possible to be proactive. And the proactive umbrella of the healthcare continuum is geared towards health restoration, prevention, and wellness. And the reactive model acknowledges this side of the equation, the importance of lifestyle, diet, shifting away poor habits, the importance of social support and relationships, but is ultimately ill-equipped, poorly trained, and overburdened by the reactive way of thinking for there to be sufficient proactive and restorative measures to address the terrain. And this is exactly where naturopathic medicine comes in, and why it works, and why I do what I do. We are experts on the right side of this healthcare continuum. This is what we are trained for, and this is what we provide strategies for. But we're also trained on the left side of the healthcare continuum, the reactive side, which informs us of the value that that side holds in certain situations, and even some naturopaths being able to utilize those tools on the reactive model on a state-by-state basis. So what we have to understand is that we are so complex as human beings that it's not always so easy to apply reactive type of therapies on chronic patterns and illnesses. If we just wait for problems to arise without considering the factors that create or compromise our health, i.e. the root causes, we will forever be in a cycle of temporary fixes, which is a solution for sure, but does it sound like the most efficient and holistic approach? So naturopathic doctors and other approaches like them create a natural bridge between the reactive and proactive worlds of the healthcare continuum. So should we worry about the germ? Of course. But what about you as the host and what comprises what we call the terrain? So the sobering fact is that we will never be able to contain or eliminate germs completely. It's impossible, because they are also living systems, just like us, that are merely trying to survive, just like us. So what we can do is make our own capacity as individuals and communities as robust as possible, so that the relationship between the two is more balanced. So the concept of the terrain recognizes that it's not enough for the bug to be present to guarantee illness, but instead it's the relationship between the presence of that bug and the state of the terrain of the individual person. So by terrain, we can think of it as the soil of a garden or of a being. So the garden needs the seed or the bug for sure, but it also needs a certain type of soil, an enriched soil with particular types of conditions that are administered on a regular basis. So this would be the water, air, light, and fertilizer in order to allow for growth or lack thereof. But this is also the lifestyle and healthful factors that create a healthy terrain for the human being. So what goes into a terrain? The terrain is based on all the different systems in our body, including the nervous system, our fight or flight, how we respond to stress, the endocrine system with the hormones, and the combination of those two to create metabolism, which is the fuel for our life. How we think, how we perceive, the self-limiting beliefs and emotional patterns that are within our life, all contribute to the terrain and how we react and respond as individuals physiologically and psychologically. Our organ system function, the function of our organs of elimination, which are our bowels, our skin, our urinary tract, and our breath and our breathing. The microbiome, all the other bugs that help and do all these essential functions to keep us healthy and functioning, our genetics, our epigenetics, which is the modification of our genetic potential based on how we treat ourselves in our past history, our lifestyle and diet, of course, and what makes up our past and current environments are all part of the terrain. So the concept of health and illness is not so linear when you look at a list like this. It's not A to B. It would be amazing if every ailment was experienced in the exact same way for every single person, and that it developed in the exact same way as every single person for the exact same reasons, and that there was some magic pill that would take it all away instantly. But we know this is not the case. This indicates that naturopathic medicine and approaches like it are essential for the broadening and the deepening of our perspective of healthcare. And the choice between conventional medicine and naturopathic or integrative medicine is a false choice. Because as I've said, they each hold their own intrinsic value with some overlap and unique characteristics, and they contribute to what constitutes the healthcare continuum. And where you fall on that and how you get treated and approached, it's all one continuum. Just as you wouldn't pick sides between a surgeon and a physical therapist following a sports injury, you see that they each have their trained skill set, right? And they come from different perspectives and approaches, but the logic of combining both approaches creates a more positive outcome for you as a patient than could have ever be reached with only one of them in isolation. This is called synergy. So the philosophy of the right side of the continuum, the proactive side, which naturopathic medicine and therapies like it are experts in, is one of considering the terrain of the person. And the terrain is our inner environment. It's the inner life activity, which is intimately connected with the outer environment. In fact, as I've said, the environment in which we live is part of our terrain. And by health restoration and wellness, we're referring to all the factors that are helpful to the terrain. And to a certain extent, it sets the conditions for the body to achieve balance in a way that only the body knows how. So we don't know exactly how to mechanically engineer an old growth forest and all the interactions that occur within an old growth forest, just as we can't engineer a healthy immune system like the replacement of a part in a machine. As dynamic living systems, we can only give the conditions like a humble seed in a garden and allow for our own system to heal itself. The reactive side of the continuum is brilliant in its innovation, and it can't be understated or diminished. It's absolutely essential and necessary, and it can be life-saving and control symptoms to a point of keeping someone safe while you work on the right side of the equation. But the notion that we can employ mostly reactive therapies to complex systems with long-term chronic imbalances would only be helpful if we were machines with separate parts. And for relatively simple systems like a car, if your transmission is busted, you replace the transmission, problem solved, and you have a functioning car. But for complex systems like ourselves, instead of just fix it and forget it, we talk about set it and let it. So in other words, if we create the conditions with proper nutrition, movement, lifestyle, the functionality of our interconnected organ systems to know balance, to consider the effects of the neuroendocrine centers on metabolism, to investigate our mind-body connection, how stress plays into it, our microbiome, our elimination of waste, social supports, relationships, self-kindness, self-compassion, self-responsibility, how we grew up and where we came from, then we can truly give the body a chance to come into balance. We can facilitate the body's own self-correction and appropriate responsiveness. And if this seems in opposition to the reactive model, we must consider, like the surgeon and physical therapist, this is only one lens to look over the same overall healthcare continuum. So, discussing the likelihood of future pandemics and preventing chronic disease, we can proactively act. So our modern world is comprised in a way that will create future susceptibility to pandemics. It's not a matter of if, it's when, and we've seen that it's come to pass in the last few weeks. We are connected and we travel amongst each other, us billions of people, in ways we've never before seen in previous generations. The current pandemic will likely subside in time, but nature works in cycles, so it's definitely possible that this virus, COVID-19, or others like it, will be seasonal visitors to our population. Hopefully it will evolve in a way that is less infectious and contagious, but novel viruses, new viruses we've never seen before, are going to continue to present themselves to our modern world, and there's no one to blame. They're part of nature. And the only certainty that we can have right now is that we cannot control or predict exactly how the environment around us behaves. And despite the illusion that we're somehow displaced from the natural world, living in our buildings surrounded by concrete, our modern luxuries, please realize more now than ever that we are part of nature, and the attempt to control our environment will always be limited and be far too complex to ever be practical long term. What this time can present to us is an opportunity to reflect on how we live and what we rely on, what is truly important, what place we have here as a living thing relative to nature, and the power we hold to give ourselves the best chance to be resilient and stay healthy. It is not only the outside bug or the environment. We have to consider the health of the host, our terrain. This is what naturopathic medicine and approaches like it are oriented towards addressing. We can alter the terrain. And who gets sick? Being healthy does not necessarily mean you should never get sick. We see in this pandemic, for instance, it's infecting most demographics, including those deemed healthy with no existing conditions. It's also reported that many infected experience mild symptoms or no symptoms at all, whereas others end up in the hospital. And what does this indicate? It indicates that each person has a unique terrain, and that state of the terrain is how they respond. The expression of the terrain is the response of the presence of that bug. The response of your terrain can either be harmless and below your awareness, so you're just carrying the disease, you're carrying the virus, but you're not experiencing anything, or it can be exaggerated to the point of it's a life-threatening situation. So ultimately, the question we are asking is not how bad the bug is, but rather how appropriate is the individual's immune system functioning in relationship to that bug being present. So being unable to respond at all with no immunity compared to responding so exaggerated to the point of a life-threatening situation are two sides of the same coin. So it's all about the appropriateness of your immune response. So it's the same bug, it's the terrain that the bug is interacting with, and that is our focus on this side of the paradigm. So working with naturopathic medicine, we talk about and we offer strategies, expertise in keeping this response of the immune system appropriate, not boosted, not suppressed, but appropriate for you in this situation and what needs to be addressed. And the toolbox that we have is geared towards the unique situation of the person seeking help to give their terrain as an individual the best opportunity to respond appropriately. Just like we give the garden each season the best chance to grow healthy fruit for harvest. This should be the focus. And this is part of the healthcare continuum that can be addressed and optimized for a whole approach. So this time of uncertainty, we can be empowered and we can shift our focus of the uncertainty and what's going to happen next to an actionable list of things that we can do to serve as an opportunity going forward following this pandemic and even during it. We can optimize our health. So life presents us with uncertainty all the time in many forms, and it's usually not as obvious as a pandemic, right? There are things that we can control. We can creatively respond in ways that we never conceived of prior to a challenge. We've seen this before, whether it's at work or with family or with friends. Not a challenge presents itself and we respond in a way that's creative and unique and it gets the job done. So we can choose to see this unprecedented time as an opportunity to reset and reevaluate the capacity of our terrain to be in its best form. Because there is a high likelihood of future epidemics and pandemics, and even some form of COVID-19 returning. So instead of feeling powerless and uncertain about the situation, we need to ask ourselves, how can we care for ourselves now? And how does that determine the appropriateness of our immune response in the future? And we've seen in the past, times of crisis lead to new patterns, not only individually, but as a society. For example, condom use and STD testing became normalized in our society following the HIV/AIDS epidemic decades ago. Perhaps 20 seconds of hand washing will be the norm now after this passes. And with the grip of a global pandemic reaching us for the first time in our lifetimes, some will be wondering how to protect ourselves. And as we said, perhaps we can create new patterns now of nourishing our terrains to be ideal for who we are in ways we couldn't have conceived even a few weeks ago. But the importance of the difference between the bug and you, the host, is a different way of thinking about it, and exactly what naturopathic medicine and approaches like it are trying to accomplish with the proactive side of the healthcare continuum. So whether you're already in the upper age groups or a teenager, you can optimize your health. You can set the conditions for a robust terrain. Your nutrition, your movement, your sleep, your relationships, using herbal products and supplements, homeopathy, massage, chiropractic work, acupuncture, conventional medicine, they all play a role. And the joy of working with naturopathic medicine is that we find the best route that's for you as a unique individual. It's not one size fits all. And naturopathic medicine serves as a bridge between this reality of the terrain, the soil, and the necessity of the conventional reactive therapies that need to be in place. But the terrain is the life activity, and we must consider life. If we just react to disease and ignore the terrain, we are limiting our range of healthcare, and we're in the business of putting life back into healthcare. So in this presentation, what we've discussed is the role of naturopathic medicine in addressing the terrain and your responsiveness with a robust terrain, where we are in the place and what the healthcare continuum is and how it can guide where we are and how we approach each individual person. The consideration of the germ versus the host, and it's really more of the relationship between those two components. The likelihood of future pandemics, and with that shifting from the uncertainty and fear and anxiety surrounding that near certainty, and the opportunity to keep ourselves in the best position possible. My name is Ben Schuff. I'm a naturopathic doctor and licensed dietitian nutritionist. Be well, and thank you.